Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
glad to be here.
But a mission to
Delivery of Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Laura Rothfeldt, and she is the State Public Health Veterinarian at the Arkansas Department of Health. Dr. Rothfeldt, thanks for joining us.
Thank you. Thanks for having me today.
So we're talking about tick-borne disease awareness. So let's first start and talk about the health department provides outreach and education. Tell us what that is.
So we do provide education in the forms of we give presentations to both the general community. I mean, we presented to the master naturalist. We also present to medical providers and healthcare providers in different association meetings. We have spoken at the University of Arkansas for Medical Sciences. We teach at the College of Public Health. So we just provide education out there for the community. We do as well put up tick posters, so tick awareness posters. So we actually have put these out at all of the state parks and the national forest, and they actually have a little QR code over here where you can actually shoot your phone at that and get some more information. So there's that, and then we're developing some tick removal kits that we'll be providing out at some health fairs out at, for the general community, and maybe even some things like baseball games and various places where we might be able to reach out and get some of that education out about tick-borne diseases.
What are the common tick-borne illnesses that you see in Arkansas?
So in Arkansas, we do have a lot of tick-borne diseases. We have the most common is going to be ehrlichiosis, which is a big word for bacteria, Ehrlichia. And then we see something that is similar to Rocky Mountain spotted fever. And in fact, it's been counted as Rocky Mountain spotted fever in the past, but we think it's a different bacteria that's causing a little bit similar but a little bit different disease than really Rocky Mountain spotted fever. So we're trying to determine what is actually causing illness in the patients that have a test that kind of tests positive for that, but it's probably something different. It's still treated the same way with doxycycline. We do have a disease called tularemia, which is can be transmitted in a whole lot of different ways, but can also be transmitted by the bite of a tick. And then on the smaller scale, there's some diseases that are transmitted by a black-legged tick, which transmits Lyme disease. We don't see a lot of that in our state because it's a much less common tick than what we have that transmits all of the other diseases.
And tell us about alpha-gal. Is that a part of those illnesses as well?
Sure. So alpha-gal is not actually an infectious disease. It's an allergy. So it's very similar to food allergies, but a little bit different in that it's a delayed onset. So alpha-gal has only been known for about the last 2 decades, but we think that people have had symptoms for many years prior to that even. But what it is the name alpha-gal comes from a sugar molecule that is actually found in non-human mammals. So all of the other mammals outside of humans and actually large primates. And so it's found in things that we use for protein sources such as beef and pork and deer and venison and bison and all of the mammalian meat products. But we think now that people get sensitized from it from the tick bite. And so the tick saliva contains alpha-gal as well. And really certain species of ticks, mainly the Lone Star tick, which is what we have here in Arkansas. Now there are other ticks that have been implicated, but they don't show that they're causing as much disease as they are here in Arkansas. But what it does is it sensitizes a person and it makes them develop an allergy to these meat products and mammalian products. So if a person develops this condition and then wants to eat a big steak dinner, and then a few hours later they might become ill with things like hives or a rash or even upset stomach, abdominal pain. We see a lot of GI symptoms versus what you think of as true allergies. And it's also delayed versus like a peanut allergy, which happens right away. So these alpha-gal allergies actually are a little bit delayed unless it's something that has been injected, a product that has a mammalian derivative in it that gets injected into that person. Then, of course, it's a much quicker reaction.
Is it tough to diagnose, or is there a blood test or something that's a part of it?
Yeah, so it's actually not that difficult to diagnose. There is a blood test, and the blood test, what it tests for is an elevated antibody to this, an IgE antibody, which is the one of the allergen antibodies, and it's an antibody to this alpha-gal sugar molecule. Now, lots of people out there are going to have elevated levels of these antibodies and not have any symptoms at all. So you can't just do a blood test. It actually, you have to correlate it with symptoms that are related to it's a cause and effect. So, the person either receives this product or eats this product, and then within 2 to 10 hours of that, they develop a certain set of symptoms that are related to this allergy. And those are the cases that we consider true alpha-gal cases.
And Arkansas is the first state to record information about it.
Yeah, so we're the first state to make it reportable. So there are diseases across the nation that are nationally notifiable, such as measles. If you think about that, or if you think about something really severe like anthrax or something, it's going to be nationally notifiable. But for certain states, they can also make certain diseases reportable. And that is, so for Arkansas, we made that reportable in September of last year of 2023. And we were the first state to make it to be mandatorily reportable. There are other states that are looking into this. And there are some states that have some voluntary reporting.
And what do you want healthcare providers, to know about alpha-gal, about any tick-borne illness? What is the biggest part of all of this you want them to know?
Yeah, so let's talk about, we'll separate them because we have the infectious diseases and the allergic ones. So a little bit different. So the infectious disease and tick-borne diseases typically occur most likely in the summer. We do have, of course, with our weather here in Arkansas, it's quite we could have ticks out in the middle of the winter when we're not having freezes and stuff. So, but typically there's a peak in the summer with things like fever, malaise. They just don't feel good. And we really call that the summer flu. They could have a rash, muscle aches, body aches, things like that. If that's going on in the summertime and you've got a person who enjoys the outdoors, then even if they've reported a tick or not, then you want to consider tick-borne disease. And in those instances, it may be appropriate to go ahead and start treatment before the test results come back. What we don't want is to start treatment just because a person says they were bitten by a tick. Because there's a lot of times when you can just, fend off that disease, or may not even have been infected, on your own. So you don't want to get treatment unless you do become symptomatic. And the thing about with alpha-gal is to start thinking about patients that maybe historically have had some chronic GI issues. We're starting to notice that potentially those patients with chronic inflammatory bowel syndrome have been diagnosed. Patients that you may think have a gallbladder attack. It may actually be an alpha-gal because they do report a lot of abdominal cramping and pain. So you want to do a really good, thorough history about when do these symptoms come on in relation to what the person is eating. And then, like I said, the people, Arkansas is the natural state. We do like to go outdoors. So there's a lot of people that have been bitten by ticks. There's also a lot of people who've never seen a tick on them in their life. They've never seen one in person. So you've got, kind of that extreme of, I say that, there are some people that never get off the concrete, and then there's other people that, they step on their lawn and they'll be bitten. So.
And there was a task force for alpha-gal about a decade ago. What has happened since then?
Yes, so there was a task force started in 2015, and it went on for a couple of years till about 2017. I think 2018, they had passed another bill to let it go on, and it actually expired in December of 2018. So I came on board in May of 2018, and I have the historical documents from that task force and what they did and what they found, and I have I have kept that, and we use that as a resource and a reference binder. And that's certainly a great group that was put together to do some research into alpha-gal, because there were some interest in it from people that were affected, and then also people in public health were seeing this kind of weird phenomenon. And so it did go on for a couple years, but it has been disbanded per the legislator. So there is no legislative task force per se. But from a public health perspective, we've been involved actually since I started in 2018 in a working group with the CDC and several other states. And so we've been doing that. We've been meeting monthly. We helped develop and author the standardized case definition for alpha-gal. And then we've been on this working group ever since then.
And you touched on this briefly, but is Lyme disease here? Are you seeing it prominently in Arkansas?
So we're not seeing it, here in Arkansas. We see it in very small numbers. And a lot of that has to do with the fact that we do not have that, the black-legged tick is not that prevalent here, as well as even the black-legged ticks that we have picked up on, they're not carrying the Borrelia pathogen, which is the parasite that causes Lyme disease. So Arkansas is considered low incidence. We don't say that it's not here. We do think that there are some cases that we have identified that have not traveled to endemic areas, endemic areas like the Northeast or the Upper Midwest. So we do think that some patients may acquire it here. We just think that it is extremely uncommon, and we're much more concerned about the other tick-borne diseases that can make people very ill and need to be addressed and need to be treated. And so we want to make sure that Lyme disease gets a lot of press, but we have one of the highest numbers of the other tick-borne diseases outside of Lyme disease. So we're definitely affected. It's just in a much smaller quantity.
And just because you get bit by a tick doesn't mean you have one of these illnesses. Is that right?
Yeah, correct. So, getting bitten by a tick, they may have a pathogen, they may not. But, if you're getting bitten and they are not feeding for long enough, then they may not have the time to pass that pathogen or that disease. So it may be that, for Lyme disease, they think that the tick should feed for over 36 hours. So at that point, that tick is well fed and engorged and big. If you pull off a tick and it hasn't fed for but just a small amount of time, it probably hasn't passed a bacteria. It could possibly pass a virus, though. So there are viruses out there that we're identifying, such as Heartland virus, Bourbon virus, and Powassan virus. And those viruses may be known to pass very quickly within 15 minutes of feeding. Now, the other thing is just because you do get this pathogen in your body, again, your body has its own innate immune system. And if your immune system has the ability to win the war against the pathogen, then you will never show any signs or symptoms. And that's great. But unfortunately, sometimes people's immune system wanes for some reason, and they don't win that battle. And they end up showing symptoms, which symptoms are also kind of your body still trying to fight off that pathogen. And so, so there's times when we don't win and we need to have some additional support through antimicrobials.
And tell us how the community should protect from ticks and mosquitoes. What is the best practice for that?
Yeah, so number one is we want everybody to enjoy the outdoors. We want everybody to have a good time out there, but we want you to do it safely. And so we want you to make sure that you do use permethrin on your clothes. You can treat your clothing with permethrin. You can treat your socks and your shoes. You can also use EPA registered approved repellents on your body, such as DEET or picaridin. There's a big list on the EPA website of products that are safe to use to repel these insects and arachnids, actually, for the ticks. But you also want to wear long pants and long sleeve shirts. I say that, but a lot of people are not going to do that in this heat. But yeah, if you're going to be out, doing a lot of yard work or something like that, it might behoove you to do that. And also to do a tick check when you come inside. We want you to just do a tick check and then also take a shower and just wash everything off that may be sort of crawling on you that hasn't had a chance to go ahead and embed in there. And so we just want you to use caution. As a veterinarian, I always have to caution as well to protect your pets, because your dogs and your cats will go outdoors. They can also get disease. They can get the same diseases and they can get a little bit different. They can have their own set of diseases. And so not only can they get sick, but they can also then be a vehicle to carry those ticks inside. And so, Fluffy comes up and jumps on your bed and you cuddle with Fluffy, and Fluffy was carrying a little tick passenger on him. And then that tick decides to jump off Fluffy and then decides to bite you. That's one way that you can get that as well. So we want to protect ourselves and protect your animals as well.
And if a provider suspects a tick-borne disease, are there certain tests more reliable than others?
So there are different types of tests for different diseases. And so, right now the big thing is PCR. We really want people to use PCR tests for Ehrlichia and Anaplasma. There is unfortunately not a PCR test for the spotted fever rickettsiosis that is effective right now. So unfortunately, we tend to rely on serology, and serology can also indicate just a past infection. So we have to use that with caution and interpretation in light of the current symptoms. But yeah, if there's a PCR available, we would prefer you use a PCR test. And then on alpha-gal, of course, it's the antibody test.
And is it best to treat before they're symptomatic?
So in Lyme endemic states, they do recommend a one-time dose of doxycycline for a bite by the black-legged tick. So it's really that you identify which tick bit the person, and then you can go ahead and do a prophylactic dose. But in non-Lyme endemic states like Arkansas, they do not recommend to give that one-time dose. They just recommend to wait 2 weeks after a tick bite. If there are symptoms that develop, then at that point, the person should be evaluated. And again, if they are symptomatic, you are recommended to go ahead and start on treatment while you wait on the test results.
Well, Dr. Rothfeldt, thank you for talking about this important information today and all that you're doing for the state to keep us free of ticks and illnesses. I appreciate you today. Thank you.
Sure. Thank you very much. I appreciate the opportunity.
And that's it for this episode of AFMC TV. Thanks for watching. Have a great day.